The broadcast is now starting. All attendees are in listen-only mode.
Hello, everybody. And if you're here for this installment of Practice Perfection webcast, you have come to the right place. This is Danny Bobrow, President of AIM Dental Marketing, and I want to welcome you to this installment of the Practice Perfection web-based education series. Today's presentation is entitled, Are You Fluent in Gobbledygook? And I am thrilled to be hosting Ms. Toni Segrist Adams. Before we get to today's webcast, let me remind you that Practice Perfection webcasts run for around 90 minutes. While attendees are in listen-only mode, I do invite you at any time to submit your questions or comments using the question button on your screen. We will allow time following the presentation to get to your questions, and if we're not able to do that, we will be sure that they're answered shortly thereafter. As an attendee to today's presentation, all licensed dentists, dental assistants, and hygienists will be offered the opportunity to receive 2 hours of CE credit upon completion of a post-test and evaluation. Ms. Toni Segrist Adams is speaker, writer, editor, publisher, specialist in communication issues in healthcare, and the 2009 RDH Phillips Mentor of the Year. Ms. Adams practiced dental hygiene in San Jose, California for 26 years. After retirement, she returned to school to earn bachelor and master's degrees in communication studies. She is passionate about sharing the implications that intercultural, nonverbal, and instructional communication, as well as listening, have for effectively sharing the links between oral and overall health with patients. Toni is a much sought-after speaker, which is why we sought her out, who has won awards for writing, speaking, scholarship, and leadership, published articles and presented papers with numerous health-related publications, and continues to serve on 2 editorial advisory boards. She has taught college-level public speaking courses and has published 5 of 7 volumes in her Dental Communication Brief book series that I am in the midst of reading and absolutely love. She is also a proud wife of 45 years, mother of 2 wonderful sons, and grandmother of a brilliant and beautiful 9-year-old granddaughter. I am joined this evening by Virginia Norton, who will field your questions during today's talk. And now, it is with great pleasure that I introduce and welcome to Practice Perfection, Ms. Toni Segrist Adams. Hello, Toni.
Hi, Danny. How are you?
Very well.
Sounds great. So I will just go ahead. Welcome, everyone, to this program. I thank you for being here. And thanks to Danny and Practice Perfection for inviting me. It's a great opportunity to share this program. Just a couple things before I get started. This is a big topic, so really what I'm giving you today is just an introduction or a review if you already know something about it. The research that I used to create this presentation is mostly medical because there's just not that much in dentistry, although we're starting to see more, and I will be talking about oral health literacy, a big report that came out about a year ago. If anybody is interested in the references or a handout that has a little glossary and some resources in it, just email me and I'll give you my email address at the end of the program. So we've gotten past this. Today we're just going to define some terms and understand low health literacy and learn how to recognize people with low literacy, low health literacy, understand a little bit about plain language, and hopefully acquire some communication skills to work when working with people in this group, and also talking about literature, resources, and forms that we use, and just overall enhance your linguistic competence, which is the ability to communicate with all people regardless of how literate they are or how proficient they are with English. So I just love this quote, communication is the most common procedure in medicine. It is how we get things done. It is critical to what we do, and the purpose of this program is to help us become better communicators. And Daniel Webster eloquently said that communication is the essence of human life, and that is true not only in our private lives, but also in our business lives. Communication, this is how we would like communication to happen. We would like the message sent to be the message received. There is no interference, no change in meaning. What she says is what he hears and understands exactly. But unfortunately, people think differently. And so this is really more the way that communication happens. She has a thought in her brain, and even this picture isn't quite as complex as I'd like it to be. She has a thought here, and the words that she uses to express that thought may not be exactly, she may not be able to express it exactly. The words that come out of her mouth go through a labyrinth of interference, thoughts and noise and all kinds of things happening, and then what goes in his ears, what he hears, and the way he interprets what he hears are different too. So the message is changed 3 or 4 times from the time it leaves one person till the time it reaches another person. And the upshot of all that is that we actually share only a portion of what we think we're sharing with people. And of course that's complicated when a lot of things get in the way, which we're going to talk about today. So communication is complicated and confusing, and we're hoping today to help you be more sure that the message sent is the message received. If you remember nothing about this program today, I hope you'll remember 3 things. One is ALF, which I will explain later in the program. One is you can't tell by looking, and one is I hope that you will minimize your assumptions about people with low literacy. Moving on. And this is another quote that I love. Illness is a foreign country. Many people need a guide and a translator. And so when people walk into our offices, it's like entering a foreign land. There are strange smells, strange sights, strange language. All kinds of things are different. And so we are the guides and we are the translators, and the purpose of this program is to help us be better guides and translators. And of course, when you're attending to literacy issues, what you're doing is patient-centered. You're focusing on each individual. It's certainly an element of informed consent, because if someone consents to a procedure and they really haven't understood the information, is it really informed consent? And finally, it's also evidence-based, and we know that evidence-based care is divided into 3 parts. The first is the evidence from the literature, of course, that's very important. From the peer-reviewed, highly regarded journals. The second is the clinician's knowledge and experience and judgment when it comes to caring for a patient. But then the part that I think is often forgotten is the patient. And the patient is the patient's knowledge and experience and preferences are also part of the evidence base. And so I contend that what the patient has to share with us is part of the evidence base, and that we should think of the patient as a part of our team, as shown in this little cartoon. I just love this one too. So this program will be in 3 parts. First of all, just defining some terms and overviewing the issues, identifying people with low health literacy and low literacy, and then caring for those people. Gobbledygook, the incomprehensible jargon of professionals. It's our language that we use, that we need in order to communicate well with each other and concisely. But sometimes we lapse into it, we forget, and we use it in front of patients, which makes it very difficult for patients to understand what's going on with us. And every profession has their own gobbledygook. I take my car in to get it fixed, and they say that your razzmatazz needs a new flubbergub, and because it's broken. And I trust them. And then they say, and that'll be $800, and I trust them, so I say, okay. Even if they show me the parts and they tell me a little bit about them, I still don't get it. But I trust them, so I'm going to go ahead with it. And so if they could explain a little bit more that this particular part makes a difference in how well your brakes work or something like that, and sometimes they do, then that's going to make it much easier for me, and that's part of the point today. So are you, the listeners out there, fluent in gobbledygook? Well, of course you are. All of us speak dental gobbledygook and medical gobbledygook, and not completely, but we know a lot of medical terms as well, and we use a lot of those in our practice. Now, I have a little video here. It's about a minute long, and I apologize. I understand that the sound doesn't come through that great here. But even though you may not be able to hear every word, I'm sure you're going to get the message. How have you been? It's been 6 months. What's new? What's exciting? Good. Everything's gone. All right. So. Patient presents the class 1 occlusion. A little suction in there. Overbite is 30%. Overjet is 3 millimeters. PMJ, check that. Open it for me, Nico. Oh. Good close, no clicking. Patient has a convex profile. 20 is slightly rotated labially. The anteriors have prominent mamelons. Like that. Bicuspids can optionally be sealed. And interproximal tight contact. Okay, I think that's familiar to all of us. Sometimes that's what yeah, that's how it sounds to a lot of people when they come to the dental office. First of all, I just want to say, wouldn't it be wonderful if every patient looked as good as that one does? Oh, what a beautiful mouth. Okay. So here are just some random terms that I pulled out from dentistry. Some of the words that we throw around every day that just make people crazy. And I do have to tell you that my spell checker went berserk when I was making this slide, because 90% of the words here are not in the dictionary, or not in the spell checker dictionary. So just to kind of remind us of some of the language that we use. Now, just to know about literacy, everybody knows that literacy means that you can read and write. But a lot of people don't realize that there are 2 other parts to literacy as well. And one is the ability to speak and to make yourself understood and to listen to others and understand and remember what they have to say. And then one part has to do with being able to work with numbers, to compute. And that is a huge issue. It has its own name now called numeracy, or numerate. People who are good with numbers are called numerate. And there's a whole area of research around that alone. And it's very important in healthcare. There are many ways that people need to use numbers in order to maintain good health. So and in the United States, we say that there are about 90 million people, roughly 50%, roughly half of the people who sit in our chairs have low literacy. And about 20%, or 1 in 5 of the people who sit in our chairs, are what they call functionally illiterate. And I hate that term. It just has a stigma attached to it that I just can't stand. I use it for want of another one. And I've racked my brain trying to think of another one that is appropriate, and I haven't been able to. So if anybody has any ideas, I'd love to hear them. And just to expand on those statistics a little bit, if you're talking about population numbers, most low literate people are native born and white in this country. If you're talking about percentages, low literate people tend to occur more in older minority immigrant groups and in people with less education. But it can include anyone. And it will surprise you, some of the people who have low literacy. And it might explain some things about some of the patients that you're wondering about. What happens is, it's not that people can't read anything. They can read a lot of words, but they tend to read word, 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 and don't really put them together in a sentence or a paragraph to get meaning. And that's further complicated if they don't recognize a word, then they tend just to skip that, which of course can change the meaning a lot. Someone who is literate would tend to look up that word or try to figure it out. So overall, they don't get the context of what's being written about, and they wear out quickly because it's exhausting to try and figure all this out when it doesn't come second nature to you. Numeracy, as I mentioned before, is understanding anything that has to do with numbers. And Mark Twain's famous quote about lies and lies and statistics really comes in here because it's difficult for many of us to understand numerate information. And there's a report from the Institute of Medicine that came out just last month, and they say that 13% of U.S. residents are numerate. That means 1 in 8, 7 out of 8 of us are not numerate. And in this case, they defined numeracy as being able to calculate the cost of life insurance based on a chart that told the cost per $1,000 of coverage per month. So in other words, in order to figure that out, people had to do 2 computations, and that was very difficult for a lot of people. So even people with a lot of education may not be good with numbers. And part of the problem is that it's not really acceptable in the U.S. to not be able to read. And so that's why a lot of people don't share that information. They don't tell people. But it's okay for us if we don't know. You know, you can say, well, I'm not a numbers person. I just don't, I just don't do numbers, people will say. And that's considered acceptable. So the bottom line is that it does impact health, and it contributes to poor health when people cannot keep track of a lot of things that have to do with numbers. So what happens, some of the things that are difficult for people who are not literate or numerate are they can't read the newspaper. They can't look for a job either with a newspaper or online. They can't read instructions, which would include instructions that come with anything having to do with health care. But I just love this picture because it's just so typical. Those instructions that come with things you put together are confounding sometimes. Reading a recipe is more difficult. Recipes can often have unusual words and ingredients. You have to know math. You have to perhaps know proportions if you're going to double or cut a recipe in half. Lots of things about recipes can be difficult. Difficult to find your way around, either to read a map or read a schedule, to read signs, to read a bus schedule or a train schedule, say as if you're trying to get to a dental appointment. That can be a problem. Just have trouble working with numbers in general. And numbers include the dates and times, appointments, reading the appointment reminders. Some people in this short video I'm going to show in a minute, a woman got confused between Tuesday and Thursday. So her appointment was on Tuesday, and she thought it was Thursday, and she missed her appointment because of that. So
I wonder, Tony, if there's any studies that show the trend in that regard, because I think someone just told me recently, I just heard for the first time, that smartphones make dumb people. Everything is becoming so automated that I would fear, venture to guess that the percentage of numerate people might just well be falling in this country, just as is the level of health. And, I thought was just reminded when you showed that gentleman with the instructions, we couldn't see the instructions, but, these days, I think maybe it's an acknowledgement or a concession to this reality, but more and more of those assembly instructions do have pictures on them. And I'm actually wondering if there might be some lessons, even for literate people, numerate people, that in our communications that maybe, someone said a long time ago, a picture's worth 1,000 words. And I don't know if you talk about that or not, but maybe visualizing in pictures, an important part of communication.
There is a lot of research about patient education material and pictures and how you should place pictures and what kind of pictures you should use and so on to make it more understandable for people. But I know my husband purchased a desk from IKEA a few months ago, and the instructions were all pictures. There was not a single word on the instructions. And that's because it's international. And so you don't have to worry about printing instructions in 12 different languages. So anyway, another part of numeracy is difficulty with working with time and keeping track of time and money and bills and things like what is the provider and what is a co-payment and not covered, what does that mean? So a lot of things that make it difficult. In healthcare, it's keeping track of medicines, when to take them, how often to take them, how many to take, all of that. And especially in dentistry, diabetes is such a huge problem in this country and related so much to periodontal disease that it's so important for people to be able to take care of themselves and follow the directions completely. To work with any electronic devices to read just for pleasure, just for the sheer joy of it. And one report showed that low literacy predicts health. And because of all those things that I just said, low literacy predicts health more strongly than age, income, employment, education, race, or ethnicity. More than all of those things. The only thing I can think of that might be have a greater impact on health would be genetics. It's quite astounding, really. And also, a mother's literacy level predicts her young child's health more than income or neighborhood. And we're talking about young children. We're talking about preschool. After children go to school, then the neighborhood has more of an effect. But this is true not only in third world countries, but also in the United States. And I just had to sneak in a picture of my granddaughter here, and I just love the little dental reference. Okay.
She looks brilliant, too.
Oh, and she is. Well, she's 9 now. So,
okay.
And to know that according to the literacy site, in middle-income families, there are about 13 books per child. But in poor families, about 1 book to 300 children. And that is important because of this great study that came out, a sociological study, where they retrospectively looked at studies. Apparently there's a question that's common in sociology studies. 2 questions. One is, how far did you go in your education? Another is, how many books were in your home when you were 14 years old? And what they learned was that the more books there were in the home, the farther in their education children in those homes went. And that had nothing, it was not related to how educated the parents were, what kind of work they did, or how much money they made. And it was in 27 nations throughout the world. And the oldest reference that I found on that list was from 1925. So in 80 or 90 years, this has been true, and they don't really know why. I knew you were going to ask that, Danny, so I got that on there before.
Thank you.
They just don't know why. But it's something they call a scholarly culture. It's a reverence, it's a respect for books and learning that seems to spur these children on to get more education. So I think, wouldn't it be wonderful if we gave out books in the dental office instead of those little toys that we give out? And I have researched it a little bit, and there are places where you can get inexpensive books, which I can talk about later if somebody is interested. And again, my granddaughter last year, reading to some friends' children. And I love this picture because it shows the joy of reading right there on her face. You can see it. And that little boy is so engrossed in that book, he could not get much closer. And I just love that. It just shows everything that's good about being able to read. So just a little activity here. It's kind of hard to do in this format, but I hope that you will look at these words. And I went online and went to some dental office websites, and looked at some forms. A lot of dentists nowadays put the forms online, their health histories and such, and so people can fill them out before they come in, which is great. But these are words I found on forms that are actually online right now. And we have to think of ways that we can translate these forms to something that's understandable for people, such as bacteria. We want to talk about germs, not bacteria necessarily. Now, when we're talking about an antibiotic, we know that's a drug, that's a medicine that kills bacteria only, not viruses or other kinds of germs. So then we have to distinguish among different kinds of germs. And abscess, now I'm sorry, I'm trying to point, but for some reason, there we go. Abscess, we can say pus. And pus is a powerful word, and people know what that is, and you really get the message across with that. And so all of these words have what, it doesn't have to necessarily be one word. Immunocompromised, that we can just say that your immune system is not working so well, and that people can understand. So we have to think about the words that we use, and one of the criteria is you try to get rid of as many words with 3 syllables or more as you can. Now, maybe you can't, but and if there is no other word that you can use or even a phrase, then you just have to explain what you're trying to say. So a person's literacy level impacts their health literacy and, of course, their oral health literacy. And health literacy is the ability, first of all, to find health information, to understand what you've found, to compare and contrast conflicting or different types of information, and then to actually use it to make you and your family healthier. The Institute of Medicine report that I alluded to earlier came out just about a year ago on oral health literacy. And the main points that they made that I got out of from reading their report were that lay people, these are the main areas that lay people, medical people, and unfortunately sometimes even dental people, probably not anybody that's on this webinar, but some dental people are either don't know or don't share with their patients. And the one is so fundamental that baby teeth are important. We need people to know that oral diseases are caused by microorganisms. We need to tell people that. And because that's true, then in many cases we can prevent them, we can treat them, and in some cases we can actually reverse them. And then the big one, of course, that Danny's so interested in and that I'm so interested in is the relationship between oral health and general health. So important. Those are things that we really need to tell people. So, and just another point is that people who are very literate may not be very health literate. They may know a lot about engineering or law or a lot of other things, but still know very little about health. And even when you go into a new area of health, if you need a new specialist, you need to learn a whole new language and start all over again with a lot of health information. But on top of that, when you're stressed, when you're in a health situation, very often, especially in the dental office, you can be frightened. You may be in pain. You may be taking some medication. You may not be feeling well. So even when you're highly literate, it's difficult to use all those skills because you have all of those other stressful things going on with your life. And we can scare people. I mean, look at this. Does it look like something from outer space? That's pretty scary. You can barely see anybody's skin anymore because there's so many coverings that we use, and we have to use them for infection control reasons. But think of how that impacts the patient. Every once in a while, sit in the patient's place and kind of look and see what it feels like. I used to tell people a lot to look at the eyes, but you can't even see the clinician's eyes here. And a lot of what we do tastes bad, and it can hurt, and people are afraid of pain, even though it may not hurt. I used to say to people when I was pretty sure I wasn't hurting them, but they were just squirming and around, I would say, well, does that hurt, or are you afraid that it's going to hurt? And most of the time they would say, I'm afraid that it's going to hurt. And they had their faces all scrunched up like that, which of course makes our work a lot harder. Now, we like to think of ourselves as the superheroes that are going to save the world's teeth, and this is how we like to look at ourselves. But unfortunately, patients may look at us this way. And my favorite part on this picture is this right here. But and this is the dental part of it, and dental hygienists don't get off scot-free. Now, there may be some calculus. We do encounter calculus that would require a mallet and chisel to get it off, but we don't use those. And we try to be as gentle as we can, but unfortunately, this is what patients are worried about is going to happen to them when they come to our office. So you add all that together, and it comes down to about 9 out of 10 people in the U.S. have trouble understanding and using the health information that we give to them. And then you add to it also, health is confusing. There are many, many aspects to health care that people have to think about. It's not just our information, and even just nutrition is confusing. Is caffeine good for you or not? Yesterday it wasn't, today it is. There's a new study all the time, and they're constantly changing that. These nutrition labels drive me crazy. You think of what it takes to be able to understand these. Now, I know there are laws that say you have to include certain information in here, but think of how difficult this is even for a literate person, and low literacy just compounds it. There are a lot of unusual words that people don't understand. There are percentages. You need to know the metric system, which most Americans do not know the metric system. There's just a lot of difficult information on these labels. Now, I understand that they are changing them, that they're quote unquote simplifying them, but I've seen the new ones. I don't see that much difference. I see some information more prominent, easier to find, but I don't see the information being simplified that much. The medicines that we use. This is the list of the non-steroidal anti-inflammatory medications that need a prescription, both the generics and the common names. I say common with a little bit of irony there. This is crazy. I don't know where they come up with all these names. And these are just the ones that need a prescription, never mind the ones that are over the counter or all of the other kinds of medications that are out there. So the bottom line, what happens is people have trouble learning about health. Prevention is the first thing that goes out the window when you have low literacy and you're embarrassed and you're worried that somebody might figure it out, or when it's just so much work to try and figure something out. You wait until something gets really bad, and then you go to the emergency room. So prevention is lost. Difficult to make informed decisions, so give informed consent. Difficult to follow directions, take medications, understand forms. Those HIPAA forms, oh my gosh, they're crazy. And overall, it's a big cost to the country, but it's also a high cost to individuals. They're more likely to be unhealthy, to go into the hospital, and even to die because of low literacy. And that's just a tragedy. Most of the literature that we give to people, they cannot understand, most of that. In the U.S., most people read at an 8th to a 9th grade level. It depends on where you read. Some say even a 5th to 6th grade level. But most health literature is written at not just a college level, but a college graduate level. So you can see the disconnect there. And there are many. You asked about, is there any literature? There are over 800 studies in different areas that show that most of our materials are unreadable for about half of the people who come into our offices. The Department of Health and Human Services came out with an action plan, and they have many, many strategies, and I selected these 3 because I think they're so important that all healthcare providers in any field, when they're in their training, they should have coursework. They should be tested on that coursework when they go to try and earn a license, and there should be CE requirements, much like the CE requirements for CPR and others in different states. The American Dental Association also has a plan that they came up with, and my 2 favorite of the many, many strategies are to develop health literacy CE courses, so here we are, and to train dental students more in communication. And I think that should go with dental hygiene and dental assisting and obviously any training course. So the introduction, we're past, and moving on to recognizing people with low health literacy. Now, you may think you know. Well, you can tell, but the point is, who of these people do you think has low health literacy or low literacy? Is it the really sweet lady, or the angry people, or the smoker, or the freaked out guy, or any of these? And the point is that it could be all of these people. It could be none of these people. You can't tell by looking who someone is. Many people with low literacy do not wear a sign that says that, and they try very hard and work very hard, put a lot of effort into hiding the fact that they can't read. Now there is a movement to use a test. They've called it the REALD, the Rapid Estimate of Adult Literacy in Dentistry, which was adapted from one in medicine. They say it takes only 3 minutes and we should test everybody who walks through the door. Well, how would you feel if somebody asked you to take a literacy test? So I don't agree that should be done. And Archie Willard doesn't agree. He learned to read when he was 54 years old, in his 50s. He didn't learn to read until then. But his concern is that this is a kind of handicap and a weakness, and he doesn't want to have to display it to people, and that those written tests are seen as a step backward, and it turns us away. And that's the last thing we want to do, is to turn people away. We can't help them. It doesn't help us. It doesn't work for anybody. So I say, but the problem then becomes, if you can't tell by looking and you can't test people, then how do you know that someone has low literacy? And there are some signs if you're alert to them, and I'm going to give you some now. First of all, the main thing to know is that people with low literacy and low health literacy are not stupid. Literacy is usually not an issue of intelligence. It's more of an issue of education and perhaps environment. And even though someone may have gone through 12 years of school and graduated from high school, they still may not be reading at a high level. But that doesn't mean that they can't learn. And so the fact that they're, I hate that term, but it puts it right out there, that because it's not an issue of intelligence, people are capable of learning if we can take the time and the effort to find the way that works for them. And they usually are very embarrassed and stigmatized by not being able to read. One woman in one of my courses when I gave this program told about a relative who was married to a man for 7 years before she knew that he couldn't read. And the only reason that she knew was because she asked him to read a story to their child, and he had to admit that he couldn't read. Now, can you imagine the effort and certainly the intelligence that it takes to hide that fact from your spouse for 7 years of marriage, and who knows how many years they were together before that? And there are studies to show that people don't tell their friends, they don't tell their families, they don't tell their coworkers, and they, in many cases, do not tell their spouses that they cannot read, and they find really clever ways to work around it and to get help when they need it. It's really quite amazing. So you can't tell by looking at someone. But this is a list of some clues. These are just clues. Now, one clue, one incident is not conclusive. You need several incidents at least and some repetitions. But here, these are just a few clues of things that you might watch for with some of your patients to help you realize that someone may have some trouble with literacy. So if they walk into the office and the sign says, go over here to, if you're here for Dr. So-and-so, go to this window, or please give your appointment slip to the receptionist, or something like that. If they have trouble doing that, that could be a sign. If they have trouble with forms, or they bring someone with them to help them fill out the forms, or they ask to take the forms home so someone can help them, that might be a sign. They may not focus on text. So you give them you're showing them a brochure and you're pointing out certain things, but you may notice that the eyes just aren't really focusing on the words, actually. They can't name their medications. There's something in medicine they call the brown bag test, where they ask people to bring in all of their medications in a brown bag. And then they pull them out, and the doctors can learn a lot from seeing what they're taking. But when they do that, and you ask the patient to name what medications they're taking, they can't really remember. They get them mixed up. And there's a woman in the video that I'm going to show you in a few minutes who will illustrate this. And so what they do is they don't, when you ask them to name the medication, they don't look on the label. They open it and they say, well, that's my blue pill that I take for such and such or whatever. They often miss appointments because trouble with times and dates and reading, of course. A person may be a flake, or a person may have trouble with literacy. Less likely to get their prescriptions filled, to take their medications properly, to go for tests or to see specialists, whatever you're recommending for them. I used to work with a patient who every single time she came in, she forgot her glasses. Now, that was pretty clear to me that this woman had a problem with reading, but I shudder to think that people who I didn't recognize as low literate, because I didn't really understand all of these signs. And sometimes the frustration and the embarrassment come out as anger. Have you ever had a patient who refused to fill out a health history, who refused to fill out forms? You don't need all of this, and they stormed out, and you're left there dumbfounded. What was that about? Well, it might have been something else, but it also might have been a literacy issue. So you want to look for patterns and repetitions. Don't just one time, if somebody forgot the name of their medication or missed an appointment, that would not indicate literacy issues. And you can also ask people, how do you like to learn, and what do you like to take home with you to help you remember what we said today? If they say that they like a brochure, they want a link to a website that they can read about, or they want a book or some other printed type of information, then most likely they do not have trouble with literacy. But if they consistently say that they like to talk to their friends or their family, they like to watch television, they like to watch videos on the internet, that sort of, or see pictorial demonstrations of things, then that might be a clue, another clue, that literacy is an issue. So now is the video that I'm going to show for you. This video is about 23 minutes long altogether. We're not going to watch all of it, so, but we're going to watch about 3 to 4 minutes of it, and it will give you an idea. This is people who are speaking from the point of view of low literate people in healthcare. And just a really powerful video. I recommend it highly for a staff meeting. 23 minutes, perfect time to watch it, and then time to discuss it among the staff members so that everybody's on the same page. But you'll just get a taste of it now.
I was sick a lot. I was sick a lot because I probably missed dosage and didn't realize that I was in the hospital a lot. When they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. Mm-hmm. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
We had a child that was physically handicapped that I had to do physical therapy on. I would show up on Tuesdays instead of Thursdays for the appointment. I would be exercising the wrong side of the body.
I had an abscess in the ear one time. Well, I had to fill out forms and it didn't fill out, so I didn't go. I come back home. I ended up having to go to the emergency room that night because it burst.
Health literacy is the ability to read, understand, and act on medical information. Unfortunately, millions of adult Americans lack adequate health literacy skills. The doctors, researchers, and patients in this video are real, not actors. The situations, frustrations, and complications are also real. Nearly half of Americans have health literacy challenges. Odds are some of them are your patients.
Can you imagine what it's like, you being a patient and sick, and you know that you have limited skills, okay, and you're talking to an intelligent doctor like yourselves, and these people are using words that you really don't know because they're not speaking in layman's terms, okay? Right. Most doctors are just presuming that everybody's intelligent as they are, and that is just not the case. So what you do, you come out of that room, that examination room with this intelligent woman or man thinking, God, I hope I don't make a mistake with my medicine because I did not understand anything he or she said to me.
The heart of the problem is a disconnect between patient ability and healthcare communication. The average American reads at an 8th grade level, but healthcare information is often communicated at a college graduate level. This disconnect leads to confusion, frustration, and a feeling of helplessness for patients and physicians. While healthcare information can confuse even highly educated patients, those most vulnerable to misunderstanding are the 1 in 5 adult Americans who are functionally illiterate.
Take one capsule.
That's right. One capsule.
One capsule. I don't know this. Twice daily.
Okay. So how would you take this?
When I see it's not only telling you how to take it, it says take it twice daily, but it don't say what time to take it.
For people with limited literacy skills, the world can be a challenging one. 21% of adult Americans can't read the front page of a newspaper. 48% can't decipher a bus schedule or make sense of a bar graph. The problem is even worse in the healthcare setting where emotions run high and vocabulary is unfamiliar.
Based on our decade of research on health literacy, our research group has documented clearly that patients who have inadequate health literacy are more likely to be hospitalized for their chronic illnesses. And this is regardless of their socioeconomic status, whether or not they have a primary care provider, regardless of how ill they are. Tell me which one is which and what do you take them for?
It looks like my medicine that he gave me for the morning. I take that and there's a little pill. So this is the Praz, but this is lithium, isn't it? Yeah, that's lithium.
Okay. And what do you take that medicine for?
Don't ask me. He puts me on there, and I just take it.
Okay.
Anything he tells me to take, I'll take it.
Okay. So you trust him?
Oh, you better believe it, my life.
Research.
I'm going to stop there. Pretty compelling, I think, that information. There are many more stories on this video. So I hope you will go to YouTube and watch it with your staff. At least watch it yourself.
That's great, Tony. And I think it's important, if I may, just underscore that those people didn't look stupid to me. They looked.
No, you would. I would not have guessed most of those people.
And I know you're saying that it's not a matter of stupidity; it's just of of lack of education. But they don't look uneducated to me either.
No, they don't. They don't. That's the whole point, is that you can't tell by looking. So I hope.
Well, and it's an important point because we don't know which patients may just be, kind of faking their way through, and how much that's limiting our ability to help them.
My point precisely. Thanks, Danny. That's true. That's exactly true. So I hope that maybe you can share this with your staff and you can ask these questions. You can talk to your among yourselves. Do you recognize any of the patients in your own practice? And I have to say that I can some of the people that I used to care for. And I'm so sorry that I didn't know about this at that time. And what will you change the next time you take care of some of these people? How are you going to handle them better? How are you going to help them better as you progress and now that you know more? So I hope that this will be a great one for your staff. And I just want to point out, a lot of people miss, is that the woman mixed up Lipitor and lithium, which could be devastating if she took a message over the phone and somebody said, well, cut down on this or that, or add to this or that, and she added the wrong one. That's just horrible. And also later on in the video, one of the people interviewed is a pharmacist assistant, which I don't know about you, but that is pretty scary to me. So you can't tell by looking. So moving on to what we can do to help people with low literacy and low health literacy. And one of my favorite topics is listening. I wrote a whole book about it. And so listening is much more than just hearing. It's actually paying attention to the message that comes across. Listening and speaking are equally important, and that both the listener and the speaker are responsible to make sure that the message sent is the message received. A very common complaint among dental patients, and almost the most common complaint among dental patients, is that we don't listen to them. So very important for us to add listening to our repertoire if we're not doing it. And sometimes we think we're listening, but maybe we're not. Sir William Osler, one of my favorite people for quotes, listen to the patient, he's telling you the diagnosis. And he said that many, many years ago, but there is research to show that in medicine, about 75% of diagnoses are made through the health history alone. So if you're not listening to people, you're not going to get the right information in order to make that right diagnosis. So of course we want to pay attention to people, let them talk, and I have to say it was really hard for me to find a picture with the healthcare provider listening and the patient speaking. I use a database to get a lot of the pictures that I use, and I put in health, communication, listening, all that, healthcare provider and patient, and with almost without fail, every picture was the healthcare provider speaking and the patient listening. So I finally found this one. It's not the highest resolution, but I just love it that it shows a dentist listening to a patient. And there are advantages for both patients and practitioners. Patients are less anxious. They get better diagnoses and outcomes, and because of that, then they're more satisfied. And those advantages, the exact same things, are advantages for the clinicians as well, because it sure is a lot easier to take care of people when they're not fearful, and it's also always better for us if our diagnosis and outcomes and the patient satisfaction are better. But in addition, patients like us better. They're more loyal to us. They're more likely to come back to see us. They see us as more persuasive, and they're less likely to sue us, which is always a good thing. And to the patient, when you listen, what they're getting from you is that you are empathetic, that you are respectful, that you care about them, that you have patience, and that you're more competent than someone who doesn't listen. It's amazing to me, just the act of listening. So why don't we listen to better? Well, it's difficult. It's not so easy to listen. It takes some time. It takes some effort. You have to really focus on it. But there are some things that we can do to help us listen better. One is just try and get the distractions out of there, and especially people with low literacy. They will want some privacy and some quiet so that you can speak to them easily, and you pay attention to the speaker. Do not be texting or looking at the computer or looking at the chart. You focus on the person. You can take some notes. Actually, if you take a few notes, it shows that you want to get the information right, but don't write War and Peace. If you need to fill it in later. That's pretty easy to do on the computer. And look at the patient's nonverbal communication as well as listening to their verbal communication. So look at the whole message that they're getting. I think in the little video that we saw at the beginning of the program, there were a lot of times when the patient had a quizzical look on her face. She didn't understand, and the practitioner just zoomed right by that, didn't seem to notice at all. So we want to look for those expressions and make sure people are getting the message that we're sending. And be aware of our own nonverbal communication and provide feedback. Let people know, that lets people know that you're listening. And feedback is such a thing as saying, oh, yeah. I didn't quite get that. Can you say that again? Or sure, yes, oh, I agree. That sort of thing lets people know that you're paying attention to what they're saying. And challenge yourself to listen. Yes.
You know what I think is an unfortunate reality too, because in our coaching with team members on mostly on telephone skills mastery, we hear the team member either being afraid of silence or rushing through something because they think that the person with whom they're communicating is impatient and doesn't want that. What they don't realize is that apologizing and asking somebody to repeat even something as simple or basic as their name shows a great deal of respect and shows that you're listening, especially for somebody who may have a difficult to pronounce name. The few extra seconds you take to spend with that person will entirely change the quality of your communication, because now they know that you're listening and that you care.
Yes, well, it's part of patient-centeredness. You don't think of patient-centeredness on the phone, but certainly it should apply to all areas of care. I talked to some students about interviewing, and I asked them, when does your interview start? And I tell them that the interview starts their very first contact with that office. And you have to think of a patient calling, it's kind of like an interview, like they're interviewing us. And
that's right.
How you are on the phone with them is your very first impression, their very first impression of us. So important. A good point, Danny. Thank you. So anyway, challenge yourself to listen more than you speak. And I recommend 2 minutes. Some research has shown that doctors tend to cut patients off at about 30 seconds into their opening statement. And this is after you've had the social graces, you've talked about your vacation and how the kids are doing and all of that. Then you're getting down to business and you want to hear what the patient has to say. Now, this wouldn't happen every single time. If you're well acquainted with the patient, they're coming in to get a quick filling or a check of something, then you're not going to have to do this all the time. A lot of this applies mainly to new patients or to people who are having problems. But in general, patients are cut off after about 30 seconds. Most people need only about a minute or less to explain themselves why they're there. Now, of course, there are those people who go on and on and on. I'm not talking about that. I'm talking about the average person. So if you challenge yourself to give people 2 minutes for their opening statement, most of the time you won't need that amount of time. So that's one way that I think you can listen more. And another favorite picture of mine is this a really good listener? And the answer I often get in my audience is yes, but actually it's no. And the reason is because there's no feedback. He's certainly not going to talk back to you. He's certainly paying attention, but his mind could be anywhere. So you need a little feedback to let people know that you hear what they're saying. And the most important part of listening is, now you may have heard of or watched the old television sitcom called ALF, Alternate Life Form, about a fuzzy guy who came from outer space and lived with a family. Excuse me. Well, that's not this, but that might help you remember this. ALF, in this case, stands for always listen first. So give people a chance to tell you where they are, the first thing, before you tell them what you think they need. Because once you know what is on their minds and what is important to them, then you can put your treatment recommendations in the context of their needs and wants. And you're more likely to have the patient follow through with your recommendations. And building trust. Now, this is a list that sounds like the Boy Scout pledge and things that we all know, but just to remind you, and that people with low literacy tend to be more sensitive to these issues. So maybe bend over a little backwards to do some of these things. Be respectful to people. Helpful. Do little things like, if they forget something, mail it to them or whatever. Empathy, patience, and avoid stereotyping and judgment. Now, we all try to do that, of course, but with people with low literacy, they're particularly sensitive to these issues. And the receptionist on the left, and it's as if she's saying, how can I help you? And the one on the right is saying, I dare you to ask me a question. And this is all of us sometimes. There are times when we just don't want to be bothered, and it's true. And the people in the clinical people are not exempt from this either. And I'd like to talk a little bit now about plain language and how we actually speak to people. Plain language is a movement that started in the federal government to try and make governmental language more accessible and understandable to the average person. And it has spread to many other fields, including healthcare. It's huge in healthcare now. So you want to speak plain language, and you want your literature that you give to people and the forms that you have people fill out written in plain language. And this is just an overview. It is a huge topic, very interesting topic. But just some of the highlights are you want to use short sentences, and you want to use the active voice. You want to say she did this rather than this was done to her. You want to use everyday words, or what they call living room language. You want your information to be clear and logical. If you have several points to make, you want to make them in a logical order rather than just throwing out random information. So you want it simple but not simplistic, which can sound a little condescending. And some people ask, well, if you use plain language, are literate people offended by the use of simply written materials or simply put materials, language? And the truth is, no, usually they're not. Everybody appreciates something that's made simple. And I think, as a writer, that the hardest thing is to make something simple. It's really easy to make something complex and convoluted and long and dense. It's very difficult to make something understandable in a simple way. So use
and you're making the distinction between simple and simplistic. That's a very important distinction.
I think so too. And when you use examples, make sure that they relate to the person that you're speaking to. And look for literature that is user-friendly and forms. And check out your website. Is your website user-friendly? There are some guidelines. I just, by coincidence, happen to have some links to places that you can use to help you understand that a little bit more, links on my website. So I'll tell more about that in a bit. And so just some phrases that I took from some forms that I found online. And this is from a form about, and the heading was how medical information about you will be used. We will use your medical information as a part of rendering patient care. Now, why do you have to say rendering? We will use your information to take care of you. How about that? Isn't it much easier? It just seems like it's simpler, easier to understand. And on an insurance form, I have a whole list of these that when I give this program in person and we actually work on them. I just chose a couple here. But in any such case, just how about when that happens? It just seems so simple, but we're trying to be make things easier for people. So there is a wonderful handout that I can either mail a PDF to people or I can give you the link. It's from the National Maternal and Child Oral Health Resource Center. It's called The Way with Words, and it's a guide to writing oral health materials for people with limited literacy.
You can send that link to us, and we'll include it in the follow-up email to our attendees.
Okay, great.
It's our pleasure.
And what I want to say is that a lot of people say, well, I'm never going to write any material. But it's really also a very good way to evaluate the materials that you have. There are other ways, and another one is what is the SMOG test, which is the simplified measure of Gobbledygook test, and that also is in the handout. I'll just send you the handout, Danny, and you can mail that to people. You can email that to people who are interested.
Terrific. Can I read it too before I send it?
Of course, of course.
Of course I will.
Yes, but it's a great. It's just a short form, just really a little longer than one page, and very concise. And it really illustrates the point that it's trying to make. So, and you can find a lot of them on my website as well. If you go to my TonyAdams.com, Tony with an I, and go to the resources and links, you'll find a lot of different, a lot of information. So other ways to help people: provide some privacy. People need to feel secure that they can share information. Spend a little social time. People like to know that you care about them as people, that you know them a little bit as people, and that helps us with our care as well. So perhaps when we're listening to someone, they're talking about their vacation or whatever, we're also looking at their color. We're listening to their voice, the strength of their voice, and just some of the details of their lives that might impact the way we take care of them. The so important part of the nonverbal communication is to sit on the same level face-to-face with the person. In other words, don't be standing or don't be sitting when the patient is laying back. As much as you can, I know it's not always easy, as much as you can, try to converse with the patient at the same level. Take your time. Don't try and cover too much information. If you can cover one point well, that's easy for that people can understand well, then you will have accomplished a lot. If you give them too much information, they don't get anything, they get frustrated, they may not come back. They may say, oh my gosh, I just can't handle all of that, and just not return. Find forms that are easier for your patients to use. And again, there are some links on my website. And I do have to say about my website, I just want to throw that in while I'm thinking about it, is I'm in the midst of switching to a new format. So there is a lot of work that I'm doing right now. So if some of the links don't work, I apologize. And if you need help finding them, you can email me, and I'd be glad to help you find them. So show me and teach back are patient education methods in which you confirm the patient's learning. So you ask them, and of course you don't say, I want to make sure that you were listening to me, so what did I say? You say, I want to make sure that I was clear. So could you tell me what you heard me say? Or as far as showing me, when you go home, if your husband asks you what you learned today, what are you going to show him about using that brush that goes between your teeth? Or something like that. So you put it on you, and you make it, say it in a way that that helps the patient repeat. Just the act of repeating is going to help them remember, and then you will know whether or not you actually were clear. And use all kinds of visual aids, all kinds of aids. There are lots and lots of YouTube videos. You can use models. You can use demonstrations. You can use recordings of any kind. Just mix it up a lot, because people will get something from one kind of demonstration and not another. So the more different ways you do it, and studies show that people learn better when they learn things in several different ways. One way to address low health literacy, a couple of years ago I had an ear infection and an eye infection at the same time. And I had oral antibiotics to take, but I also had drops for my eyes and my ears. And when I picked up the prescriptions, the pharmacist said, don't get the drops mixed up, because if you put the ear drops in your eye, you are not going to be happy. So I looked at the boxes, and these are the boxes. I scanned the boxes. The bottles were itty-bitty, so they wouldn't have shown up here. But this is all of this, and all of this is nothing but gobbledygook. But the one thing that really helps people who can't read all this gobbledygook, which is probably most of us, are the little icons that show what goes in the ear and what goes in the eye. And the same thing was on the bottle. And I thought, well, finally, we're addressing some of these issues. And so think about how there are studies out that recommend ways to change the labels on prescription bottles. And this particular one by Wolf and colleagues, instead of do not drink alcoholic beverages while taking this medication, how about do not drink alcohol? And or just use an icon that is very clear. And instead of this big, long description right here, you can just say limit your time in the sun, and or use an icon such as this to let people know that they should stay out of the sun while they're taking that medication. And Dr. Carlisle was kind enough to allow me to use this graphic. It's what they call a pill card. And wouldn't it be wonderful if when people came in to the dental office, everybody had one of these. We would know exactly what they're taking. I love it. It shows what the pill looks like, whether it's a pill or whether it's injected. It tells what it's for. It tells you when to take it, and then it shows you when to take it and how much to take. So this one you just take at night. These you take 2 in the morning and 2 in the evening. And these you inject this much, 24 units in the morning and 12 units in the evening. I just think it's a great idea, and I hope it becomes common. And a little bit about numeracy. Numbers are important. There are a lot of numbers in healthcare, and people need to understand them. So don't back off on giving numbers information, but just try and make it as easy as you can for people. Get out all the extra information that really isn't necessary. Get to the bottom line. Highlight the parts that are most important for that particular person. When you're questioning people, ask questions in several different ways. Maybe they'll understand one way and not another. Never ever ask, do you understand? Because what are people going to say? Anybody, whether they're highly literate or not, they're going to say yes, because nobody wants to appear stupid. Very rarely will people tell you, no, I don't understand. Encourage them to ask questions. But no, very often they won't, again, because they don't want to appear stupid. Or you can come up with, what questions do you have? Because that presumes that there are certainly questions, so maybe people might feel a little more comfortable about asking them. The Ask Me 3 website is a great place for patients to go to learn about how to work with healthcare providers and how to get their information straight. And they say there are 3 main questions that people need answered. Now, certainly there's plenty other information that we have to give each person, but it's amazing how often people walk away without the answers to these questions. What is my main problem? Well, you have a decay in that tooth, so we have, and what do I need to do about it? We have to have you come back, and we're going to clean out the decay and fill that up so that it doesn't get worse. And why? And that's probably the biggest question of all. Why do I need this? And that is because if we don't take care of this, then it's going to go deeper. It could get into the nerve of your tooth and cause you some pain. And in order to fix it at that point, it is much more time-consuming, much more expensive, and more difficult for you. And if it goes far enough, you could actually lose the tooth. So if we can stitch in time, save 9 sort of thing, let's do this now and prevent it from getting worse. So that is my program, the most of it. I hope that you will remember these 3 main points. Always listen first. You can't tell by looking who is literate or has low literacy. And minimize your assumptions about who low literate people are. And of course, any or all of these people or none of these people could have problems with literacy. I hope that this has stimulated an interest. There's a lot more information about it. I hope that you will continue to study the issue and notice articles that show up in journals and online. And if you have questions or comments, feel free to contact me. And you can find more resources on my website. These are 2 excellent books that I really love. One, Helen Osborne's book, is very practical, gives you actual things that you can do. You could put it to use that day. And the Understanding Health Literacy from the American Medical Association is another excellent book, a little more academic and getting a little older now, I hate to say. There's a lot of good information. There's another whole book online, which I have listed in my reference list, the DOK, D-A-O-K. I didn't make a slide about it, DOK, and Root. And that book is out of print, but it is available online for free at the Harvard University Medical School site. So you can get the information there. So if you have questions, I hope that we can answer them. And my granddaughter and I both thank you for listening to this program. These are the books in my brief book series. And 5 of them are in print. 2 of them are still in production. I'm still working on them. And for people who listen to this program today, I have some special offers, savings on the books, speaking discounts for your group, and ways to contact me. Thank you very much, Danny, for having me.
The pleasure is mine, and thank you for getting, right on the money here, getting done right in time, so we do have an opportunity to get to at least some of the questions that have been asked, and we certainly appreciate those. Here's one from a hygienist on the East Coast. She asks if you are aware of any lobbying efforts by organized dentistry to improve health, specifically dental literacy. A lot of your references are to the AMA and the medical side of things. It doesn't mean that they're not relevant, but I'd be curious to know, too, how well-organized dentistry is perhaps tackling this problem as well.
Well, the ADA has their 5-year plan that will end next year, but I'm not aware of lobbying efforts there. And then there is a great report from the Institute of Health that came out almost exactly a year ago on oral health literacy. And there are some other reports and some more research, more and more research now. There are some highly regarded dental people, experts in health literacy and oral health literacy. So it's starting to be more of a thing, but I'm not aware of lobbying efforts particularly.
Mm-hmm. I think it's just so important, and especially as we're advancing the ability, or we're working to provide an enhanced level of care, and this is something that as a communicator and marketer always concerns me, is that my clients, or dentistry in general, the practitioners who are committed to oral systemic health, are advancing their skill set and their knowledge, their clinical array. And if you graph it, it's sort of the gap between what we know benefits the patient and what the patient is still thinking is increasing largely. Now, there are some encouraging signs on the mass media side when people like Whoopi Goldberg and of course Dr. Oz, Dr. Phil, and then this unfortunate case of oral cancer with Michael Douglas. You get some people who advocate, and then the public pay attention to that. But the challenge, I think, is only increasing, again, because we have so much more to offer. We have to learn to keep it simple, slow it down, and as you said, and that really resonates with me, is that you got to be really smart to be simple. So I think it's a very, very important
I like the way
what you're working on.
Yes, and I would like to reiterate my point about books, giving books to children. There are some programs in medicine where they give books to children every time they come into the pediatrician's office or whatever. And I was reading a story about one office where they had given the child a book a year before, and the child was back. And the mother was saying, and they were giving her another book, and the mother was saying, we got that book last year and we read it every night. And then she said to the child, now we have 2 books that we can read. And it's so sad. And I think there are many places where you can get inexpensive books. I give out books at Halloween a lot of times at the dollar store. Sometimes you can get 2 for $1 in some cases. And there's quite a wide variety. And I just I highly recommend that we give books out to patients.
Well, I couldn't agree more. And I'm very encouraged. A number of members of AOSH actually are authors themselves, and their goal is to write with as simple a manner as possible, because their audience is their patient base and prospective patients. And I really, again, like what you said, that we don't have to worry about insulting people's intelligence by talking to them. If anything, they feel better about being about understanding it. You make people feel, I don't care how intelligent they are, as long as you speak in simple terms. Because as you said, if you're an auto mechanic, do working with a manifold, whatever that is very simple. It's self-evident, but it's not to me. I don't know a manifold from a,
Right.
I don't know, a crease,
Right.
another kind of fold.
It's true. It's true.
Yep. Well, we had another attendee ask where he can find appropriate literature. I guess maybe you can elaborate on what would be appropriate. I guess that depends on the specific audience, but I guess for dental patients.
There's quite a lot of literature out there in medicine, a little less in dentistry, but starting to be more. And again, I refer people to my website, to the resources and links part to the health literacy page. And there are a lot of resources there. And there are also resources in many different languages. Not as much in dentistry. We're seeing more and more, though. And it's looking a lot better. But it's great to see that people are paying attention to this.
Well, and I think in terms of appropriate literature, there's appropriate literature to share with your patients, and then there's appropriate literature for you to acquire yourselves. And as I mentioned earlier, your book series is, I think, a tremendous way to build your communication library. It's an easy read. You certainly practice what you preach. And I don't mean simplistic. There's a lot of really good information. You go through the sort of history of thought on the subject back to Aristotle and Cicero, and you talk about the different components of effective communication and how they need to be balanced, between evidence and credibility and appealing to emotion. So I think that's a wonderful place to start, is just get your book series. That's a very good, that's what I would call appropriate literature. And can you maybe, go ahead, I'm sorry, Tony.
I was going to say that I'm glad to know that you feel that way, because that's what I was trying for.
Well, I think you've succeeded admirably. I wish I could write as simply and to the point as you do. So an attendee wants to know, as I guess others do, maybe where to get the AMA video. I think you had a YouTube link. I don't know if that was the video that's on YouTube. Yes. Maybe they both are.
Yes, and that's in the handout, which I'll send to you.
Okay, excellent.
Yeah. All of them, the link to the other, both of the YouTube videos are in there, and some of the other, and information about some of the other resources that I talked about are in the handout.
Okay, excellent. We'll look forward to getting that and sharing it then with everybody. Here's an interesting question, because I think it has another implication too. If no one in the home reads, how will giving a child a book help that child? I could see where it could embarrass the parents too.
Well, actually not. Usually, from children, there's somebody who will read to them, either a relative or a neighbor or a sibling who can read to that child. And if nothing else, the parent and the child can sit, and it's almost like reading, to sit with the child and talk about the pictures in the book. There are many ways. It's just a matter of having them, and many people are grateful to have books for their children or something. I don't think it's an insult at all. And yeah. I think it's just a very generous and kind thing to do, rather than some of those little toys that break before they can walk out of the office.
Well, it's funny, I was reminded of a very early memory when I was a child, and I was given, I still remember the book, Chicken Little, and I couldn't read a word of it, but I kind of made up the story, or maybe heard it, and I would, quote, read it to my parents. And I just remember just sort of ad-libbing through the whole book, and it was very enjoyable. I don't know how much I did for my literacy. Maybe my improv skills improved a little bit.
Well, there's a lot of pride in that. There's a lot of pride in being able to do for parents and just to have books, and that's what the studies show. So, but usually there's somebody around that will read to the child, or at the very least sit and leaf through the pages with the child.
Mm-hmm. And here's another question. Is it proper to just ask patients if they can read?
Well, a better question might be is, and that's on the AMA video too later on, a doctor explains that she gets a lot of mileage from the question, how comfortable are you with how well you read? Something like that. you can ask kind of around it. I don't know. I think it would depend on the patient and the context each time. For some people that might be appropriate, and for some people maybe not. So it's just kind of an individual, that's part of individualized care, just being able to, is this comfortable? Do you like this literature? Will this work for you, or would you like something else? That sort of thing. Be a little more specific maybe.
And I think that's an excellent point too, Tony, because again, in the coaching that we do on telephone skills mastery, it's all about setting the stage. We talk about the telephone being the first impression, the first telephone call, but the first few seconds of the telephone call are the first impression of the first impression. And where it's relevant here is that by employing effective listening skill and questioning technique, and going through the steps that we like to go through, which is establishing rapport, conveying empathy, and exuding enthusiasm about, you know, why you're all there, the patient comes to be comfortable and trusting you. And this is why this is still continues to be an art as well as a science, because every individual is different. And as you and I talked about before we came on the call today, the same person can have different reactions to the same question at different times. It's a matter of you being able to listen with your eyes, watch for the body language, connect with that patient so that you'll know when the time is right to ask a question like that. And then because when you ask it is as important as how and what you ask. So that's where the art comes in. But we're all caring professionals. That's the part that I enjoy. I can't coach, you can't coach anyone on how to care or whether to care. But people who care can be coached on how to demonstrate their caring more effectively, I think. And that's where, you know, your resources and others like them are so important.
Well said, Danny. And it all comes back to the relationship. Once you've established a relationship with a person, if you're talking about asking that question at the very first appointment, I'm not sure that I would. I would wait until I know the person a little more and get a feel for what might be comfortable for them, and when you're in private, and so on. So there's just a lot more to it than whether or not you can ask that question.
Absolutely. Well, and we've just, as you mentioned, we've just really touched on the tip of the iceberg here, and you have your website, your books are just a wealth of information that I sincerely hope our attendees will avail themselves of. And I've really enjoyed your presentation this evening. I want to thank you for a great presentation on such an important and relevant topic, as well as for the opportunity for our attendees to receive your book series at such an attractive price. I, again, really urge everyone to jump on that offer. This is a topic that's truly near and dear to me, because the ability to communicate the value of our health offering is such an important skill to master. We all have the clinical skills. We can always enhance those, but connecting with the patient is what it really is all about.
Absolutely, and I thank you very much for having me, Danny. I've enjoyed it very much. It's a new experience.
My pleasure. Yeah,
and,
the webcast, you mean? Yeah, well, we wouldn't know it. I thought it went very well, and I appreciate it. And I want to remind everybody to please watch their email as well for instructions on how to receive their 2 hours of CE credit, as well as to please be sure to mark your calendars for Wednesday, June 25th at 6 p.m. Central Time, when our special guest presenter will be Ms. Shirley Gutkowski, a fellow AOSH founder and America's dental hygienist, who will share insights into the dental team as oral environmentalist. In the meantime, this is Danny Bobrow, thanking and acknowledging you for your commitment to practice perfection. Goodbye, everybody, and thank you again, Tony.
Thank you, Danny. Everybody will love Shirley, too. She's fabulous.
She is indeed.
Take care.
You too. Bye-bye.